again. Thank you for coming here for our holistic health talk. The following are empirical measures believed to relieve hiccups. 1. Pressing your palm with your thumb firmly for 2 minutes. 2. Drinking water slowly and continuously. 3. Bending and taking a long sip of water from the first side of the glass. Weird, but it works for many. 3. Gargling with ice water for 60 seconds. 4. Going in the chest knee position for 3 minutes. Here it works. Holding your breath for as long as you can and repeat this until your hiccup stops. Then if all this doesn't work, then get closer to your fridge and get some hiccups food aid. Number 1, lemon. Sucking on a lemon continuously. Here, a study published in the New England Journal of Medicine stated that sucking on a lemon cures hiccups. 2. Apple cider vinegar. Mixing 2 teaspoons of apple cider vinegar with half of a glass of water and drinking it in small sips until your hiccups relieves. The aim here is to achieve a physical and psychological climax. 3. Butter. Peanut butter or almond butter. Holding butter in your mouth without chewing it for 2 minutes, then quickly drink a glass of water may relieve hiccup fast. But avoid peanut butter if you have peanut allergy or any other non-allergy. Watch our video on allergies on this channel. Pinching your nose and swallowing while your mouth is closed as long as you can. Swallowing with your mouth open. Trying to swallow 3 times non-stop. Hard but worth it. Taking a warm shower can relieve hiccup. Distracting yourself, starting to play a video game or watching your favorite TV show. Or your best YouTube channel can relieve your hiccups. This is about putting you in relaxation or in feel happy mode, and the more you enjoy, your diaphragm will stop spasming. Ladies and gentlemen, we are talking about how to stop hiccups. And as we continue, we thank everybody who subscribed to our channel, and if not subscribed yet, please subscribe to our channel now for more wellness and safety contents. Hiccups are involuntary contractions of the diaphragm. The diaphragm is a large muscle that separates the chest from the abdomen. This muscle plays an important role in breathing. Involuntary means hiccups happens unwillingly. In other words, nobody makes a decision to produce hiccups. And each hiccup contraction is followed by a sudden closure of our vocal cords, which produces the distinctive hic sound. So what causes hiccups? Number 1, stomach or gastric distension is one of the major causes of hiccups. This can be due to overeating or eating too much or eating spicy food. Taking a large amount of carbonated drink. Number 3, Euphagy, which means swallowing air, for example, while smoking, exercising, or chewing gum, or getting excited suddenly may also cause hiccups. In these cases, hiccups are benign and most of the times do not need any evaluation or special treatment. But in other cases, hiccups may be a sign of an underlying medical or surgical condition such as malignancy or cancer, or an abscess in the abdomen, or multiple sclerosis, etc. Though rare hiccups due to such conditions may continue and last for more than 2 days, weeks, months, even years. So, according to their duration, we have 3 types of hiccups. We have benign hiccups, the one lasting less than 2 days or 48 hours. Then persistent hiccups, the one lasting 48 hours or 2 days to 1 month. 3. Intractable hiccups, more than 1 month. Persistent intractable hiccups are very concerning and require evaluation. And they can result in weight loss and extreme tiredness. Mr. Charles Osborne is a man who had the longest hiccups in the human history. He had non-stop hiccups for a full 68 years. And history will be a video topic on this channel. Causes of persistent hiccups can be vagus nerve or phrenic irritation or damage. These nerves are the ones supplying the diaphragm muscle. 2. Central nervous system disorders. 3. Metabolic disorders. 4. Postoperative hiccups. Postoperative hiccups are the one occurring after an operation. About nerves irritation or damage. Factors that may damage nerves or irritate these nerves include a hair or something else in your ear touching your eardrum, a tumor, a cyst, or a growth thyroid gland in your neck. Metabolic disorders. Long-term hiccups may result when your body's metabolic doesn't work just properly. Examples of metabolic issues include electrolyte imbalance, which is when your levels of potassium, sodium, and other electrolytes are too high or too low. High blood sugar level can also cause hiccup. Kidney disease. Steroid drugs, mainly dexamethasone, which are used to relieve inflammation in conditions such as arthritis, asthma. Anyone can hiccups at any time. However, risk factors for developing hiccups are gender. Males are much more likely to develop long-term hiccups than women. Other factors that may increase your risk of hiccups include emotions, complications. Ongoing hiccups may interfere with eating, training, sleeping, and speaking. Hiccups can also worsen pain. When to see your doctors? If hiccups last more than 48 hours, during the examination, your doctor may perform a neurological exam to check your balance and coordination, your muscle strength and tone, your reflexes, your sight and sense of touch. If your healthcare provider thinks that an underlying medical condition may be causing your hiccups, the provider may recommend one or more of the following tests. Blood sugar levels. You may also be screened for disease and infection. Imaging tests may be able to detect issues inside your body that may be affecting your diaphragm or the nerve that controls your diaphragm. Imaging tests may include a chest X-ray, a CT scan, or an MRI. Endoscopic tests can also be asked. These procedures use a thin, flexible tube called an endoscope that contains a tiny camera that is passed down your throat and into your esophagus. The purpose is to check for issues in your esophagus or your airways. Treatments of hiccups, as we mentioned previously, most cases of benign hiccups go away on their own or with help of some of the hiccups tips that we've mentioned on this video. We are going to add more tips soon. But if an underlying medical condition is causing your hiccups, treating that condition may stop the hiccups. If your hiccups last longer than 2 days, medicines or certain procedures may be needed. Drugs used to treat long-term hiccups. In addition to medicine, some procedures can be used. If less invasive treatments aren't effective, your doctor may recommend an injection of an anesthetic drug to block your phrenic nerve to stop hiccups. Lifestyle and home remedies can also be used. The following physical maneuver and home remedies may provide relief. Number 1, breathing into a paper bag. Number 2, gargling with ice water. Number 3, holding your breath for 10 to 20 seconds. Number 4, sipping or gargling with cold water. Number 5, sucking on a lemon. Number 6, pressing gently on your eyeballs. If you have ongoing hiccups, lifestyle changes may also help, such as avoiding foods that give you gas, eating smaller meals portion. When available, acupuncture can also help. This channel aims to deliver information that supports holistic health and wellness, as well as lifestyle safety tips. All the information provided on the channel are tailored for educational purposes. If not subscribed now, subscribe to our channel now and share our content with friends and colleagues. Thank you for watching. See you soon.